All right, everyone. I am Chicago DLS Inc. I do group sessions as well as one-on-one tutoring for the Naplex and the MPJE. Shout out to Suspicious Bunch and Pharma Turtles for arranging this. We're going to do 8 Naplex style practice questions. Some are going to be biostats and some are going to be calculations. I will put the question up on the screen and then I will talk about it. You'll attempt it, put your answer into the chat, and then what I'll do is I will switch the screen and work out each problem with you and for you. Happy to answer any questions or concerns you may have as we do each practice question, and we'll go ahead and get started. So, practice question 1 is the Capri study was a randomized clinical trial published in Lancet in 1996 to assess the potential benefit of clopidogrel compared with aspirin in reducing the risk of ischemic stroke, MI, or vascular death in patients with recent ischemic stroke, recent MI, or PAD. The study's primary endpoint cluster of incidence of ischemic stroke, MI, and/or vascular death occurred in 5.32% of clopidogrel patients per year and 5.83% of aspirin patients per year. P is equal to 0.043. Assuming this p-value is statistically significant, what is the number needed to treat in order to prevent the primary endpoint by using clopidogrel compared to aspirin? So once again, we are looking for number needed to treat. Right. Give everyone a minute. And remember, if you are typing in an answer and you're not sure, feel free to put a question mark, signifying that it is a guess, or don't if you don't want to. I will say try. There are no points off here, nor in the Naplex if you guess something wrong. And I'm going to go ahead and actually, I'll just wait another couple minutes. Don't want to rush you. All right, I'm going to stop sharing and we'll switch to the screen so I can work it out. And while I'm working the problem, feel free to type your answer into the chat. Can everyone see the blank canvas? I wrote the word test. Can everyone see it? Excellent. Thank you. All right. So, number needed to treat is going to be 1 over ARR, which is absolute risk reduction. And so first what we have to do is we have to take the 5.83%, and what we have to do is we need to subtract 5.32%, giving us 0.51%. Now, a common mistake here is just doing 1 over 0.5%. This will give you the wrong answer. What you have to do is we have to convert the 0.5% to a decimal. And so what you're going to do is 1 over 0.0051, which equals 196. And so that is the number needed to treat. So if you chose 196, that is correct. Great job. Now, in some calculators, when you put in 1 over 0.51%, it may convert it for you. And also, um, remember, uh, if you answered 197, number needed to treat is rounding down, and number needed to harm you round up. Does that sound right to everyone? Everyone hear me? Right. So, yes, number needed to treat is round up, and number needed to round is down for number needed to harm. So, once again, NNT you round up, and NNH you round down. Okay? And that's because there cannot be a fraction of a patient. When it's number needed to harm, you want to play it safe. And with number needed to treat, you always want the opposite. You want to round up. So the answer to the question is 196, but I will also accept 197. Good job. All right. All right, very good. Anyone have any questions or concerns? We'll go on to practice question 2. All right. And in practice question 2, we have in the clinical trial assessing the effects on morbidity and mortality of spironolactone or spironolactone in heart failure with reduced ejection fraction, the RAILS trial, there were 841 patients assigned to receive placebo and 822 patients assigned to receive spironolactone. The primary outcome was all-cause mortality. In the placebo group, 386 patients died, and in the spironolactone group, 284 patients died. Relative risk of death 0.7, 95% CI 0.6 to 0.82, P less than 0.001. What is the number needed to treat with spironolactone to prevent one death in this study? Another number needed to treat question. This is once again 1 over absolute risk reduction. Remember, for number needed to treat, you're going to round up. Give everyone a chance to answer. I'll switch screens. Okay. Sharing. All right. So once again, we need to do N and T. This is going to be 1 over absolute risk reduction. And so in order to find out the absolute risk for both of the groups, we will do 284 over 822, which will give us 0.345. And the control group is going to be 386 over 841. That's going to give us 0.459. So once we subtract these two, that's going to give us 0.114. We'll do 1 over 0.114, which will give us 8.8. And as we are rounding up, that's going to be 9, or choice B. So if you chose B, whether you guessed or did the calculation, great job. And if you're not sure, please take a note, review after the session or tomorrow. That's what's going to help you most with retention. All right, any questions or concerns about number 2? All right, very good. And if you have one later, feel free to send it to me using direct message. All right, let's look at practice question 3. Practice question 3 says, a study was performed to evaluate the efficacy of oteseconazole versus fluconazole for the treatment of recurrent vulvovaginal candidiasis, or VVC. For the primary efficacy endpoint, oteseconazole was superior to fluconazole. Post-randomization through week 50 demonstrated the following. In the oteseconazole group, 5.1% of participants had a recurrence of a VVC episode. The fluconazole group, 42.2% of participants had a recurrence of a VV episode. P-value less than 0.001. What is the number needed to treat to prevent one recurrence of VVC over a 50-week period? Make sure you have everything down. I'll switch the screen shortly. All right. Okay. So, starting to get some answers. And let's go ahead and work this one out. It says we have to do 1 over absolute risk reduction. And so what we're going to do is 1 over, we're going to turn the decimals, the percentages into decimals. So we're going to have 0.422 minus 0.051. This will give us 2.69, which we will round up to 3. So the number needed to treat here is going to be 3. If you chose 3 or guessed 3, great job. If you're whichever resource you're using, whether it's RxPrep or whether it's Pass Naplex Now, make sure you do as many of the practice questions as you can. Don't let Area 4 sneak up on you. And if you've taken it before, understanding why you're getting problems wrong or not attempting the correct steps is very important. Any questions or concerns about number 3? All right, very good. Moving on to question 4. All right. So, in a recent study, rivaroxaban was compared to enoxaparin for VTE prophylaxis following hip arthroplasty. VTE occurred in 18 of the 1,595 patients in the rivaroxaban group. and 58 of the 1558 patients in the enoxaparin group. What is the relative risk reduction of using rivaroxaban over enoxaparin? Answer should be in a percent rounded to the nearest whole number. So I guess they want both. They want the exact answer and then round it to the nearest whole number. Relative risk is going to be the event rate in the rivaroxaban group divided by the event rate in enoxaparin group. And then you're going to subtract that from 1 to get the relative risk reduction. All right, Tony, was that your exact answer and what you rounded to, or was there an exact answer as well? All right, so let's go to the drawing board. Okay, so first we'll start with the relative risks. So we're going to do 18 over 1595, and we're going to divide that by 58 over 1558. That's going to give us 0.303. Then what we're going to do is we're going to subtract that from 1, and that's going to give us 0.697. We will take 0.697, multiply that by 100 to get the percentage of 69.7, and round that to 70%. These formulas are important to know. Relative risk reduction, absolute risk reduction, number needed to treat, number needed to harm. Very important to know. Does anyone have any questions or concerns for practice question 4 at this time? Yes. Blessed One asks, can you give us the interpretation for RRR? And that's going to be how much the treatment reduces bad outcomes in comparison to the other treatments. So here, because the relative risk reduction is 70%, the data here is showing that rivaroxaban shows a 70% risk reduction for a VTE compared to enoxaparin. So They can be somewhat misleading sometimes, but that's an academic discussion, not necessarily a Naplex discussion. So, once again, relative risk reduction tells you how much the treatment reduces bad outcomes in comparison to the other treatment. Good question. Anyone else? All right, let's go to practice question 5. JS is currently on aminophylline IV, and the decision has been made to switch her to an equivalent dose of oral theophylline. JS is currently on aminophylline dose 400 mg every 6 hours. Calculate the total daily dose of oral theophylline required to achieve similar serum levels. So keep in mind the weight of 65 kgs, height is 5 feet 5 inches, and the serum range is 8 micrograms per mil. Starting to get some answers. I'm going to go ahead and start switching screens. Everyone a minute to get their answer in. All right, very good. So let's talk about converting aminophylline to theophylline. So theophylline is about 80%, so we keep that in mind. Our total daily dose is going to be 400 mgs times 4 equals 1,600 mgs of aminophylline. So what we're going to do is we're going to take 1,600, we're going to multiply that by 80%, and that's going to give you 1,280 milligrams of theophylline. So if you answered 1,280, great job. So Vicky asks using ideal body weight. This was just a conversion question. You didn't have to calculate a new dosing. All right, good question. Did anyone else have any questions or concerns about practice question 5? All right, so going to the next one, practice question 6. So, uh, patient is BR, age is 55 years, male, 78 kgs, height is 5 feet 11 inches, with a diagnosis of chronic sinusitis. Medication orders: prepare a diluted solution of eucalyptus oil. Calculate the ratio strength of a solution prepared by diluting 20 mils of a 2% weight by volume eucalyptus oil solution to 1,000 milliliters. All right, starting to get some answers. Go ahead and do the switch. Give everyone a chance to answer. All right, let's go ahead and break this one down. So first we're going to appreciate the active ingredient in the original solution. So we're going to do volume times concentration, so V times C, and that's going to be 20 ml times 2%, which is going to be 20 ml times 0.02, and that's going to give us 0.4 grams. Next, we're going to determine the concentration of the new solution after we do the dilution. So we're going to do 0.4 grams divided by 1000 ml, which will give us 0.0004 grams per ml. And since we do 1 over to find the concentration, that's going to give us 2500. So yes, 1 in 2500 is going to be the answer that you're looking for. Great job if that's what you chose. And if you're not sure, please take a look at what you did differently and take a look. All right, very good. Any questions or concerns so far? Uh-oh. Oh, I thought it stopped the streaming. Okay. Let's go to practice question 7. 2 more. You're almost done. If you're still here and you stuck it out, great. Patient profile MB, 60-year male, 85 kgs, 5 feet 9 inches. Diagnosis asthma, allergies, penicillin. Albuterol inhaler, 90 micrograms per puff, 2 puffs every 4 hours as needed. Symbicort, 160 over 4.5, 2 puffs BID. And Montelukast, 10 milligrams orally daily. Hospital medications are or is dexamethasone 1.5 mg, POBID for asthma exacerbation. Physician wants to convert him to an equivalent dose of prednisone per oral, with options for either BID or TID dosing. Which of the correct conversions for MB's current dexamethasone regimen? All right, I'm going to type the answers into the chat. Answer choices. Choice A is going to be 5 mg BID. Choice B is going to be 10 mg BID. Choice C is going to be 15 mgs TID. And choice D is going to be 20 mgs BID. While everyone's working on it, to answer your question, Vicky, yes, we use ideal body weight for theophylline. My apologies. There's also a high yield list of medications using actual body weight. So, Pradaxa, Ticcasen, Kismia, Xarelto, and Reclast. No, those are all brand names, but those are all actual body weight. Great question. Sapphire, if you can clarify with a letter which choice it is. Right. So what we'll do is first we'll calculate the total daily dose of Dex. That's going to be 1.5 mgs times 2, which equals 3 mgs. And so as we know, 0.75 mgs of Dex is equivalent to 5 mgs of prednisone. So what we're going to do is we're going to do 5 mgs over 0.75 times 3 mgs, and that's going to give us 6.67. And so what we're going to do is multiply that times 3. And that's going to give us 20 milligrams total. And so the only 20 mg total is going to be choice B, which is 10 mgs BID. So if you chose B, great job. So Nikki asked, do you get a conversion chart for steroids? Some students report they get conversion charts, some report they don't. Because this is common, I would say memorize this. This one, number needed to treat. Basically, the first 4 problems we did, you should know all of that. Sapphire, it may help also if you post it in the general Discord chat. Maybe you'll get more feedback on that. Does anyone have any questions or concerns for number 7? Right, let's go to the last but not least question, number 8. All right, so patient is MJ, weight is 80 kgs, 6 feet 1 inch height, hypertension, type 2 DM, dyslipidemia. So the medication orders are heparin infusion, initial bolus of 80 units kg, followed by continuous infusion of 18 units per kg per hour. Calculate the initial bolus dose and the continuous infusion rate in milliliters per hour. If the heparin concentration is 25,000 units in 250 milliliters, round the infusion rate to the nearest 10. Can I enlarge the font? That is a good question. We'll wait for an answer and then I'll work it out. The hourly rate, once again, is 80 units per kg initial bolus, continuous infusion of 18 units per kg per hour. So let's start breaking down the problem. First, we need to calculate the initial bolus dose. So we're going to do 80 units per kg. We're going to multiply that by 80 kgs, and that's going to give us 6,400 units. Next, what we need to do is calculate the continuous infusion rate. So we're going to do 18 units per hour, per kg per hour, and we're going to multiply that by 80 kgs, and that's going to give us 1,440 units per hour. And we'll convert the units per hour to milliliters per hour using the concentration of the heparin solution. And they give us 25,000 units and 250 mils. So that's going to be 100 units per milliliter because we just do 25,000 divided by 250. So what we'll do is 1440 divided by 100 U per mil, and that will give us 14.4 milliliters per hour. So if you did initial 6,400 units and continuous of 14.4 mil per hour. That is correct. Two answers here, one for the bolus and one for the infusion rate. Great job. Did anyone have any questions or concerns so far?